Hey guys, my name is Chelsea Gerlicki, and I did my research on post-traumatic stress disorder and its cruel treatment. I'm sorry, I'm not very video tech savvy, so I didn't put any slides in this video, but I did attach the file of my public document, so please feel free to open it and follow along. So I'm going to start off with some quick facts about veterans and PTSD. 20 veterans a day commit suicide. Most of these patients and veterans are known to have post-traumatic stress disorder. Post-traumatic stress disorder affects over 20% of veterans at any given time. And only half of these affected veterans actually ever seek treatment. Out of those half of the veterans drop out of treatment. So only a quarter actually seek the treatment that they need. So what is post-traumatic stress disorder? Post-traumatic stress disorder, commonly known as PTSD, is a condition that consists of constant emotional, mental, and physical stress after enduring a stressful situation and/or an environment. PTSD was recognized as a formal condition in 1980 by the American Psychiatric Association. Throughout the decades, health providers have come up with many different alternative treatments to treat symptoms of PTSD. So now we're going to go over the different types of therapies for post-traumatic stress disorder. There are many types of therapies out there currently. The leading therapy across the nation, though, is exposure therapy. But there are plenty of other therapies, including psychotherapy, antidepressant, benzodiazepines, yoga, virtual reality therapy, animal therapy such as dog therapy and equine therapy. There's even some treatments that involve the use of cannabis. And of course, there's also things such as group therapy. This isn't all the therapies, it's just some of the very popular ones. So what therapies for post-traumatic stress disorder work and what doesn't work? So as I told you, exposure therapy is the leading cause. It's widely used, it's used in every state, but it's also very, very destructive. Exposure therapy makes patients recounter their horrible experiences over and over, hoping that it will someday diminish all feelings and reactions from those memories. An average of 50% of these patients who undergo exposure therapy end up dropping out because their symptoms get so much more worse. Patients who are already having difficulty struggling with their condition are driven to the point of mental breakdowns. Some providers and researchers have even denounced this treatment, calling it unethical and ill-advised any providers from further use of it. Many veterans have reported breaking down, not being able to leave their house, having a psychotic episode just from the therapy, not from their PTSD, but from the therapy. So we know exposure therapy really doesn't work, but it's still the leading therapy across the nation. Even though a lot of researchers, a lot of doctors are saying we should not use it, it's making it worse, it's still happening. So now I'm going to talk about some therapies that do work very well. Many of the other therapies work very well, and every patient is different and reacts differently to different therapies. It's just like any medication, any therapy is going to work better for some people and then worse for others. You just have to find out what's right for you. I'm going to talk about two therapies that have really amazing results, and that's dog therapy and equine therapy. Equine therapy has proven to be very effective due to the similarities in behavior of a horse and a victim of PTSD. So for those who don't know what equine therapy is, it's riding a horse, taking care of a horse, and they have these all over the country in every state where they have horse ranches that are designated for veterans to use for their PTSD therapy. And there was a study about it, and one of the studies found that 82% of veterans had reduced symptoms as a result from the therapy. So it's very, very effective. These work very well. And there's also another therapy that's actually doing great work too, which is therapy with a dog. I'm sure a lot of you have seen that. Even here at UTRGV, I know some of the veterans that have their dogs, that take their dogs to class. So you can see that right here. Many veterans active and discharged use dogs as a coping mechanism for their PTSD. The constant care and attention a dog needs helps the veterans focus on that, and that helps take away from the focus of all their symptoms that are hurting them. So overall, there are many different treatments that you can use for PTSD. So if you or a loved one you know are suffering from PTSD, seek treatment, and remember, as a patient, you have the right for the treatment you want. If you feel like something's not working or it's making things worse, remember, you are a patient and you have rights. So you can seek another doctor, you can seek another treatment. There are many options out there. Don't think that you're limited, and please seek help. Thank you guys, that's all I have. And if you have any questions, just leave a comment. Thank you.